Hey, welcome to Discussions with Dr. Dean. I am Dr. Dean, and today we're talking about neurotoxin, what some of you probably refer to as Botox. But Botox is actually just one brand of several different types or brands of neurotoxin. I tend to call them all tox for short. That way I'm not referring to one brand versus the other. I do carry four different brands of neurotoxin in my office: Botox, Jeuveau, Dysport, and the newest kid on the block is Daxxify. Now, all of these work by relaxing muscles of facial expression. So, when muscles of facial expression, when the muscle contracts, it creates an expression or a wrinkle. Oftentimes, can develop whenever you say furrow your brow. I can't furrow my brow because I'm trying, but I'm toxed in that area, so I can't do it. And so again, that's how it works. You relax those muscles, you can't create those wrinkles, or it at least slows the progression of those wrinkles. A common question I get about different types of neurotoxin is, well, how long do they last? Most of them last around 3 months for most patients. The Botox, Jeuveau, and Dysport, those tend to last about 3 months. Where Daxxify is different than those other three I just mentioned because it's supposed to last up to, or it can last up to 6 months. In my experience, I've been offering it in my office about 9 months, and it can vary from patient to patient, anywhere from 4 to 6 months for the longevity on that one. In my office, we have something called the Dean Tox Cocktail because I have a combination of neurotoxins that I like to use depending on which areas I'm treating on a patient, or at least for the ones that last about 3 months. So, and they each have different properties and behave a little bit differently. So for me, I've noticed the Dysport tends to diffuse a little bit further. So I like to use that one in an area where I want a little bit broader coverage, where Jeuveau tends to be quite a bit more precise. So I choose which one I want to use depending on which area I'm treating for a patient. If I am injecting Daxxify on a patient, then I'm going to use Daxxify for all of the areas I'm treating because I would not want to use a toxin that is going to last 6 months in one area and then one that might last 3 months in a different area. So that just doesn't really make sense. So if I do Daxxify, I do it by itself. I think a lot of times patients come to me and they're nervous about getting tox because they're afraid they're going to look fake or artificial. And it really does not have to at all. I think tox can look super natural. My goal always is, I tend to be more conservative with most things, and I'm always trying to give a natural look. Is you try not to have spocked eyebrows. You want movement in your eyebrows, but without wrinkle formation. So for myself, you can see I'm trying to furrow my brows right now. I can't because I'm tox there. I can move my eyebrows up and down, but I'm not forming any wrinkles in those areas. I don't treat my crow's feet, but for people who don't like crow's feet, we can soften and slow the progression of the crow's feet with tox. Another area we treat often are the bunny lines. So when you scrunch your nose up, that can be used, or tox can be used in that area. Also, the chin or dimples. Someone holds their lip pretty tight and they have just this chronic dimpling, which we call peau d'orange, which means orange peel. You can inject some tox in that area and it will relax that muscle and improve the dimpling on the chin. Another area that I've been asked about a lot lately is, which we've been injecting in this area as long as I've been injecting, but something we call the DAOs, and those muscles are attached to the corner of the mouth. So when you make this face, it pulls down on the corners of your mouth. So people who are concerned about the having kind of a frown look, those muscles can be injected with tox, and it can help to turn up the corners of the mouth. Another area, the jawline and the platysmal bands, which are these muscles on the neck, those can be injected with tox to kind of relax those, and it can give what's called the Nefertiti lift of the jawline. The masseter muscles, which are the muscles that clench our jaw closed. So for a lot of people who have issues with their TMJ, they're clenching at night, we can use tox there to relax those muscles, improve headaches they might get from that. But also, if your masseter muscles are enlarged or hypertrophied, you can get Tox there, and it will shrink those muscles down and help to kind of reshape the face and give it a more feminine look. People come in, especially first-time patients who've never had Tox before, and they're super nervous about they're going to look crazy. And I always try to reassure them, look, when you leave the office today, you're going to look perfectly normal. The Tox won't even kick in for about a week. And then at 2 weeks, it's in full effect. So for all of my new Tox patients, I see them back at the 2 week mark so that we can tweak it as needed. If we need to add a little bit more or how the patient feels about it. So 2 weeks before it's in full effect for most of them. Now the Daxxify is different. It's supposed to last longer and it kicks in some people within 24 hours, but it's supposed to definitely kick in by 48-hour mark. So that one, again, it's a new kid on the block. It's just altogether different than the other forms of neurotoxin that I inject. The risks associated with the procedure, you're not going to mess anybody up permanently with injecting Tox. But it's very injector dependent. I have over a decade of experience in doing this. And again, that's why I have like my Dean Tox cocktail that I like, because I've injected a lot of people with neurotoxin. But you could get some asymmetry, especially of the eyebrows. And often if a patient already has baseline asymmetry and you're trying to correct their baseline asymmetry, that can be a little bit tricky. But asymmetry is something that can happen with Tox. Again, I mean, this isn't going to be permanent. And often if there is some asymmetry, the injector can add a little bit of Tox in another area to even things out. Again, that's why it's important to do a 2-week follow-up, especially on your the first time you're ever getting it. You can bruise. It doesn't happen often with Tox because these are tiny little needles we're using to inject, but sometimes you can bump a little vein underneath the skin that you can't see and you can get a little bruise. It's nothing that you couldn't put a little makeup on to cover it up if that were to happen. But other than those two things, I mean, I guess you could have a reaction to anything that you're putting in your body, an allergic reaction. I have not seen that, knock on wood, but I mean, that can happen with anything, like I said. Headache sometimes is kind of strange that sometimes with neurotoxin, especially in the beginning, you can develop a headache, for a day or two afterwards. I think I had that happen. I've been toxing myself for over 10 years now too. So I think that I used to get headaches in the beginning, but I never have that issue anymore. And again, I don't know if I mentioned, but we can use Tox to treat migraines too. The neurologists use it all the time to treat migraines. So it's kind of paradoxical that you can get a headache from it, but we use it to treat headaches too. But again, if you get a headache, it's nothing that you couldn't take a little Tylenol to help and get rid of. But I think that's it. I'm going to show you some before and after photos and let you kind of see.
When I do what I do, don't I make it look easy, baby? I'm full